Hello, I'm Dr. Pizzadili. This video is part of my series on happy outcomes for cancer patients. Number 28, melanoma. These case reports are from the book One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelley, written by Dr. Nicholas J. Gonzalez and completed in 1987, published 2010 by New Spring Press. And this research was supervised and the case is verified by Dr. Robert A. Good, MD, PhD. Dr. Good was director of Memorial Sloan-Kettering Cancer Center in New York, one of the oldest and largest cancer research centers and hospitals in the world. Patient number 28 was a 42-year-old male who suffered from recurrent malignant melanoma. And we see in this case that he was healthy and cancer-free 4 years after diagnosis, which is very unusual. In February of '82, patient 28 noticed an inflamed, bleeding mole on his back. So that month he had the mole removed, and it was classified as early stage malignant melanoma. He was admitted to Sydney Memorial Hospital in Sydney, Montana, and they also found a mass in his liver, but somehow that was not believed to be cancerous. So the patient was pronounced cured. Weeks later, patient 28's health deteriorated. He suffered fatigue, diminished appetite, rapid weight loss. So in May of 1982, he found a new nodule in his left axillary region. Axillary is armpit. That's the axilla. So with this development, he went to the Mayo Clinic. At Mayo, he had the nodules removed and they were found malignant. They also found that the lymph nodes throughout this area were infiltrated with melanoma, a very ominous sign. The patient was told that his cancer would recur again and would probably be fatal. No further treatment was recommended. In September of '82, a new mass was found in the left axillary region. Mayo removed that malignant mass and found that to be, again, malignant melanoma. Patient 28 was told that his cancer would recur again and would be fatal. No further treatment was recommended. In September of '82, he found a new mass in his left axillary region. Mayo removed this malignant mass, another recurrent melanoma. Again, no further treatment recommended. At this time, the patient is suffering worsening fatigue and anorexia. In March 1983, the patient had a new nodule on his right forehead. And at this time, he decided to investigate alternative approaches to cancer. In April of '83, he found Dr. Kelley. This patient responded quickly to Dr. Kelley's program. Now, this is nutrition, detoxification, and pancreatic enzymes. And we found that the patient's fatigue lessened, his appetite improved, and the nodule on his forehead regressed completely. It just went away. In May of '86, the patient had his last routine visit to Mayo, and he's been going every 3 months through this whole period. He was found in excellent health with no signs of cancer. And we have to understand, malignant melanoma, when it is metastatic to regional lymph nodes, usually kills quickly. And the quote from the references, median survival of only 20.2 months in patients with 3 or more positive lymph nodes. And the references tell us that in cases like this, the patient can only expect a median survival of 20.2 months for patients with 3 or more positive lymph nodes. This patient had 5 positive lymph nodes. Patient number 28 had 3 bouts of malignant melanoma within a 7-month period. And there was documented metastasis in 5 left axillary lymph nodes. He received neither chemotherapy nor radiation. And his forehead nodule regressed completely after beginning Dr. Kelley's nutrition and detoxification program. So ladies and gentlemen, you must understand, if you have cancer, relying on the conventional cancer treatment industry is risky. They are focused on shrinking tumors, not on restoring health. We know that conventional cancer treatment is dangerous. The chemotherapy and radiation cause cancer. They are in themselves carcinogenic. And we know that surgery spreads cancer, surgery and biopsies, because they release circulating tumor cells to flow throughout your body. Now consider your responsibilities to yourself and to your family, to the people who love you, to the people who depend on you and want you around. To survive cancer, you must establish these foundations of health. An optimal body pH, that's your acid-alkaline balance. Now, most Americans are too acid, and we're way out of the optimal range. The last time this was checked was years ago, and the average American was found to be 5.5, when we should be 7.2. And every 0.1 change is a 10-fold change in actual pH. Being acid like that means your body is starved for oxygen. So your biochemistry is not going to work properly, and your immune system is not going to work properly. Dr. Otto Warburg won a Nobel Prize back in the 1930s when he discovered these facts about pH. You must balance hormones. Now today we have epidemics of hormonal cancers, breast cancer, uterine cancer, ovarian cancer, testicular cancer. Now, we're exposed to too many estrogenic chemicals, mainly in our food supplies from pesticide residues. We must get our hormones balanced. We must detoxify our body and our mind and emotions. Yes, we're exposed to thousands of chemicals today that weren't around 100 years ago. We're under constant onslaught like no other time in recorded history. And as far as mind and emotions, we all have patterns of thinking or feeling that cannot be constructive to positive good health. They have to be changed. We must eliminate infections. Now, infections can deplete the body of your immune resources, and many people have chronic, low-grade infections. Maybe they don't even know they have them, but it explains why they have constant fatigue and ill health and depression. Many people have infections that are not detectable by the commonplace testing practices and are resistant to conventional medications. We must rejuvenate depleted organs, glands, and systems. Again, cancer is a chronic disease. And so often it strikes in people that are depleted, they're tired, they've been sick for a while. The number one risk factor for cancer is aging. Because as we get older, our body becomes depleted of the necessary resources for our immune system to fight it off. And then we must use the best proven cancer-fighting nutrition. These are the elements that supplied to your body. They allow your immune system to heal itself. So ladies and gentlemen, if you have cancer, get help. Call my office. I'm not going to be your oncologist. I'm not going to be your medical doctor. You already have them. But I'm going to work to help restore your foundational health and restore your immune system so that you can survive and you can thrive and live a long and healthy life. So I look forward to seeing you, and I look forward to changing your life for the better. Thank you. I'm Dr. Pizzadili.